Could you be overlooking the subtle signs of high blood pressure? Known as the silent killer, high blood pressure often goes unnoticed until serious health complications arise. But by learning to recognize some of the hidden symptoms, you can take control before it's too late. In this video, we're breaking down 6 hidden signs of high blood pressure that could be warning you of potential problems. If you or someone you know experiences these symptoms, it might be time to make lifestyle changes and seek medical advice to help prevent serious complications. High blood pressure, also known as hypertension, affects over 1.2 billion people worldwide, according to the World Health Organization. Yet many people don't even realize they have it because symptoms can be subtle or easily attributed to other causes. Left unmanaged, hypertension can lead to life-threatening conditions like heart disease, stroke, and kidney damage. This makes it essential to identify warning signs early. Today, we'll walk you through 6 symptoms that could indicate elevated blood pressure and show you simple steps you can take to manage and lower your risk. One of the most common and overlooked signs of high blood pressure is frequent headaches. While everyone experiences headaches from time to time, those caused by high blood pressure are often more intense, occurring frequently and sometimes accompanied by throbbing. These headaches typically affect both sides of the head and may intensify with physical exertion or stress. High blood pressure headaches are caused by increased pressure in the blood vessels, making it harder for blood to flow smoothly to the brain. This can lead to pain and pressure in the head, especially during sudden increases in blood pressure, like physical or emotional stress. If you experience frequent headaches, try tracking when they occur and noting any accompanying symptoms. Reducing stress, limiting caffeine, and practicing relaxation techniques like deep breathing can all help manage headache frequency and intensity. However, if your headaches persist or worsen, consult a healthcare provider to evaluate your blood pressure and rule out other causes. Blurred vision can also signal elevated blood pressure. The eyes are highly sensitive to blood flow, and high blood pressure can cause changes in the small blood vessels of the retina, the part of the eye responsible for vision. When blood pressure is high, these vessels can swell or even leak, leading to blurred vision or visual disturbances. Blurred vision due to high blood pressure may come and go, making it easy to dismiss as a temporary issue. However, consistent or worsening vision changes are worth noting, as untreated high blood pressure can lead to lasting damage in the eyes, including retinal hemorrhages or even vision loss. If you notice any vision changes, make an appointment with an eye specialist who can check for blood vessel damage in the retina. Maintaining a healthy diet, rich in leafy greens and berries, and reducing salt intake can help support both eye health and lower blood pressure. Another common but often disregarded symptom is nosebleeds. Nosebleeds can occur when blood pressure rises suddenly, causing small blood vessels in the nose to rupture. While nosebleeds aren't always directly caused by high blood pressure, they are more likely to happen in people with uncontrolled hypertension. Frequent or severe nosebleeds may indicate that your blood pressure is higher than it should be, especially if they occur without an obvious trigger, like dry weather or nose picking. Nosebleeds may not seem alarming, but if they're recurring, it's worth investigating further. To help manage this symptom, try to keep the nasal passages moist by using a humidifier, especially in dry climates, and avoid irritating the nose. Limiting alcohol and caffeine intake, both of which can contribute to higher blood pressure, can also be helpful. And if nosebleeds persist, make sure to check your blood pressure regularly or consult a medical professional. Fatigue is a feeling of constant tiredness or exhaustion that doesn't go away with rest. When blood pressure is high, the heart has to work harder to pump blood, which can strain the body and lead to feelings of extreme fatigue. If you find yourself feeling unusually tired even after getting a full night's sleep, this could be a sign that your blood pressure is putting stress on your heart and circulatory system. Fatigue from high blood pressure is often dismissed as just being tired or overworked, but if it's persistent, it should not be ignored. This kind of fatigue can make even daily tasks feel overwhelming and may be accompanied by other symptoms like headaches or shortness of breath. To help manage fatigue, focus on maintaining a balanced diet, rich in whole grains, fruits, and vegetables. Incorporating regular exercise can also improve energy levels and cardiovascular health. However, if fatigue continues to be an issue, it may be time to get your blood pressure checked and discuss it with your doctor. Another warning sign of high blood pressure is chest pain. High blood pressure can cause the heart and blood vessels to work harder, leading to pressure or discomfort in the chest. This pain can sometimes feel like tightness, squeezing, or a burning sensation. Although chest pain is often associated with heart attacks, it can also be an indicator of long-standing high blood pressure. Chest pain from high blood pressure is a serious symptom and should never be ignored. It can signify that your heart is under stress or that there may be a blockage in the arteries. This type of chest discomfort may come on suddenly or develop gradually over time. If you experience chest pain, especially if it's accompanied by shortness of breath or dizziness, seek medical help immediately. To help prevent chest pain related to high blood pressure, avoid smoking, limit alcohol intake, and focus on heart-healthy foods like fish, nuts, and olive oil. Shortness of breath can also indicate high blood pressure. This symptom occurs when blood pressure rises, making it harder for the heart to pump blood effectively, which in turn affects oxygen levels in the body. Shortness of breath can come on during physical activity or even while at rest, and it may be a sign that your cardiovascular system is struggling. When blood pressure is elevated, your heart and lungs have to work harder, causing you to feel winded or out of breath more easily. This can lead to reduced endurance and make daily activities feel challenging. Shortness of breath is a symptom that often appears alongside other signs of high blood pressure, such as chest discomfort or fatigue. If you notice shortness of breath more often, try focusing on gentle cardiovascular exercises, like walking, to strengthen your heart and lungs. Avoiding heavy meals and practicing deep breathing exercises can also help ease this symptom. However, if you experience shortness of breath frequently or it becomes severe, it's important to consult a healthcare professional. To recap, 6 hidden signs that could indicate high blood pressure include frequent headaches, blurred vision, nosebleeds, fatigue, chest pain, and shortness of breath. These symptoms may not seem serious on their own, but together they can signal an underlying blood pressure issue that requires attention. If you recognize any of these symptoms, there are practical steps you can take to reduce your blood pressure and improve your health. Start by making small changes to your diet. Reducing sodium intake can help manage blood pressure. Focus on fresh, whole foods rather than processed items, as these are typically high in added salt. Exercise is another powerful tool for managing blood pressure. Regular physical activity strengthens the heart and improves blood flow, making it easier for your heart to pump blood. Aim for at least 30 minutes of moderate activity most days of the week. Managing stress is also essential. Chronic stress can lead to high blood pressure by causing the body to release hormones that temporarily increase blood flow. Consider incorporating stress-relieving activities like yoga, meditation, or even a simple walk outdoors. Remember to monitor your blood pressure regularly, especially if you have risk factors like age, family history, or being overweight. Regular checkups with your healthcare provider can help catch any issues early. Have you or someone you know experienced any of these symptoms? If so, we'd love to hear your story in the comments. Let's support each other in raising awareness about the importance of monitoring blood pressure. If you found this information valuable, consider subscribing to our channel for more health insights and tips. By staying informed and paying attention to these subtle signs, you're taking control of your health and protecting your future. Making small lifestyle changes can have a huge impact, helping you maintain healthy blood pressure and avoid serious complications. Stay proactive about your health, and remember that every step you take toward a healthier lifestyle is a step toward a longer, healthier life.